Bonjour. This is Ian back with another head and neck anatomy video. Today we will be discussing the bones of the skull. Before we begin, it's important to remember that the skull functions as a cavity for the brain and support for the face. And we will go over how each component contributes to the skull and its overall function. The skull is divided into two main parts. The first part is the neurocranium, which includes the skull cap. The neurocranium is formed by the paraxial mesoderm, and it functions to protect the brain. The neurocranium can be further divided into two parts, the roof and the base. The roof protects the brains superiorly and posteriorly and consists of the frontal, parietal, and occipital bones. The base protects the brain inferiorly and consists of the frontal, parietal, sphenoid, ethmoid, temporal, and occipital bones. Before we move on, let's discuss a little bit more about the sphenoid bone. Why? Because it's hard to pronounce and they hate me. So when looking from a superior view, the sphenoid bone is a large wing-like structure that consists of the greater wing and the lesser wing. The sphenoid bone serves as an attachment point for the muscles of mastication and contains several important foramina, which we will go into more detail when we discuss the foramina of the skull. The second part of the skull is the viscerocranium, which includes the bones of the face. The viscerocranium is formed by neural crest cells, and it functions to support the soft tissue of the face and protect key functional areas of the skull. These include the sinuses, the nasal and oral cavities, and the orbits. The visceral cranium consists of the nasal bone, the lacrimal bone, the zygomatic bone, the inferior nasal conchae, the vomer, maxilla, and mandible. Now that we have gone over the two main parts of the skull and the bones that make up each part, let's move on to some important features of the skull. The bones of the skull are held together by sutures, which are fibrous tissues that form immovable joints between the bones of the skull. So there are 5 different types of these sutures. The metopic suture joins the midline of the frontal bone. The sagittal suture joins the 2 parietal bones. The coronal suture joins the frontal and parietal bones. The lambdoid suture joins the occipital and both parietal bones. And the squamosal suture joins the parietal and temporal bones. A good way to remember these suture names is to remember that metopic means forehead, which is where the suture joins the bones at the front of your head. A cut down the sagittal suture gives you a sagittal view of the skull, and a cut down the coronal suture gives you a coronal view of the skull. The squamous suture is squished at the side of the head, and the lambdoidal suture looks like the Greek lambda symbol. Sutures close within 20 years after birth. But if these sutures close prematurely, craniosynostosis, which is when brain growth exceeds skull growth, can result, and this can lead to birth defects. And in conjunction with sutures, we have fontanelles, which are membranous spaces that result from the incomplete fusion of the skull bones. Fontanelles fuse together within 18 months after birth, and they are located in between sutures, and we have 2 types of fontanelles. The first type is the anterior, aka the frontal fontanelle. This is located between the sagittal and the coronal structures. The second type of fontanelle is the posterior, also known as the occipital fontanelle. This is located between the sagittal and the lambdoid suture. Once these fontanelles fuse together, the sutures between them intersect with each other, and these intersections give us 2 anatomical points called the bregma and the lambda. Bregma is the intersection of the sagittal and coronal sutures and the remnant of the anterior fontanelle. Lambda is the intersection of the sagittal and lambdoid sutures and is the remnant of the posterior fontanelle. Moving on, we can quit speaking Greek and talk about some other regions of interest in the skull. Another important area of the skull is the pterion, which is found on the lateral skull where the frontal, parietal, sphenoid, and temporal bones articulate. Because there are so many articulations in the skull at one place, the pterion is considered the weakest area of the skull cap. It is also important to note that below the pterion is the middle meningeal artery, which may be lacerated during injury of the pterion and result in an epidural hematoma. Next, we have the nasal septum, which serves as a barrier between the left and right nasal passageways. So the nasal septum is made up of many different parts. One of them is the septal cartilage. The next is the perpendicular plate of the ethmoid bone, and the last is the vomer bone. So these are the bones of the nasal septum. And then it comes to the nasal meatuses, which are air passages that are located inferior to the respective nasal conchae. The superior meatus contains the opening to the sphenoid sinus, the posterior ethmoid sinus, and the sphenopalatine foramen. The middle meatus houses the opening to the ethmoid, maxillary sinus, and frontal sinuses. The inferior meatus houses the opening to the nasolacrimal duct. Moving on, we'll talk about the mandible. The mandible consists of the ramus, the body, the head, the neck, and then we have the coronoid process, the mandibular foramen, and the angle of the mandible. During development, the mandible grows in a forward and downward direction. This is due to the reabsorption of bone by osteoclasts at the anterior and posterior border of the ramus, and deposition of bone by the osteoblasts at the posterior border of the ramus. And the reason the mandible grows in a forward and downward direction is to provide space for the eruption and alignment of teeth. Next, let's go over the ossification of bones. So there are two types of ossification processes, the intramembranous ossification and the endochondrial ossification. So starting off with intramembranous ossification, this occurs when undifferentiated cells develop into osteoblasts, which lay down bone. The bones that are formed by intramembranous ossification are the maxilla, the mandible, the frontal, parietal, occipital, temporal, nasal, zygomatic, and sphenoid bones. Now, unlike intramembranous ossification, endochondrial ossification occurs when cartilage is formed first and then gets replaced by bone by osteoblasts. The bones that are formed by endochondrial ossification are the mandible, ethmoid, sphenoid, and occipital bones. It is important to remember that the maxilla forms only by intramembranous ossification, where the mandible is formed by both intramembranous and endochondrial ossification. Speaking of bone formation, there is one last topic that we need to discuss together, which is the difference between bones and cartilage. Okay, so bones are highly vascularized, strong matrices containing collagen, minerals, and living cells such as osteocytes. Bones are composed of osteons that maximize mechanical strength and flexibility. In each of these osteons, there are lacunae containing osteocytes, which are involved in bone remodeling, as well as canaliculi, which are channels that facilitate cell-to-cell exchange of nutrients and waste. Meanwhile, cartilage is connective tissue that is avascular, flexible, and resistant to compressive forces which are usually found in the surfaces of joints. Instead of having osteocytes, cartilage contains chondrocytes, which are responsible for the production of cartilage's collagen and extracellular matrix. Alright, I have talked my own ear off and we are nearing the end. That means it's time for example questions. So each of the following bones grow via endochondrial ossification except one. Which one is the exception? The mandible, the ethmoid bone, the maxilla, or the sphenoid bone? So pause if you want, but I'm going to keep talking because I like talking. So the ethmoid and the sphenoid bone grow via endochondrial ossification, and the mandible, that's the special one, that grows via both intramembranous ossification and endochondrial ossification, so therefore the answer is the maxilla, which grows via intramembranous ossification. Now we're moving on to the last example question 2. It's worth double the points, so focus up. A laceration of the middle meningeal artery results in what type of hematoma? The choices are subdural, epidural, intracerebral, or subarachnoid. Okay, you can pause if you want, but the answer is epidural. The pterion is the weakest area of the skull, and a laceration of the middle meningeal artery, located right below the pterion, results in an epidural hematoma. Whew, that was a lot. But, of course, we have to move on to a summary of everything that we talked about today. So the first thing we did was we did an overview of the bones that compose the skull, and then we talked about the types of bone ossification and mandibular growth. Thanks so much.